was working in the backyard at my house, and I stepped on a nail that it went through my shoe, but it really didn't hit anything. It just kind of pinched the skin a little bit, took it off, and about a month later, I was in Charleston working, and my toe broke out into an infection, and it turned necrotic and started to wither and die. At that time, I went to a doctor in Charleston, and he decided that it would be best to take the toe off. And after about a week's healing, I went in, got the stitches taken out. Everything seemed to be going fine. About 3 days after the stitches was taken out, my foot swelled up like a whoopee cushion. And at that time, he referred me that I had let me know that I had gangrene and I needed to get into the hospital for emergency amputation. Before my amputation, I was an electrician. I worked 10, 12-hour days up and down a ladder all the time. I was very active in everything, and coming into it, after the first amputation was when I spent a lot of my time here in the rehab center. You know, in my mind, it was gone. I was going to be in a wheelchair forever. I was never going to be able to stand or walk again. But Jackie, she was the one that came. Jackie was the one that I met out of surgery, and she came downstairs and had me 3 days before I came up here. She was trying to talk me into walking in a walker downstairs, and I was like, I told her to just get away from me. I was like, lady, I just got my leg cut off. I said, it ain't even been 2 days after surgery. I said, I ain't walking around in no walker. And she's like, well, the quicker you get up and you can just transfer to a wheelchair will be the first step. And I didn't want to do nothing. It was really hard in therapy the first few days, or in the rehab unit the first few days, because I'm very shy and modest. You know, the first thing was the lady coming to help me take a shower. You know, it was like, you got to get out of the room. I don't want you in here. The girls here working with the walker and just with the gait belts and helping me stand and refocusing on how to use my stump to catch my balance. What it is, it's funny that I can be standing there with one leg and just knowing how I can position it and move it, that I can keep my balance longer. I'm hard-headed at times and still was having problems listening. Finally, one of the girls suggested to me of going into the room, and she said, just fall. She said, fall into the bed. She said, because that's the only thing that was holding me back, was I was scared of falling. And she said, I might as well just fall and get it out of the way. It's weird, the connection that you make with the people in rehab, but you have to let people into your life that they just become like a best friend to you. You know, you're in a position to where there's nothing you can do about what's done. I mean, me losing my leg, somebody having a hip replaced, or something else. You know, we've all had something taken away from us, and we have to regrow and get something. We have to get from where we've stopped to the next level, and most of the time you ain't doing it on your own. Because there was many days that I didn't want to get up out of bed, and it was just like, you know, I gave up. I was trying to give up, and they surely didn't let me do that. I've met many people who have had amputations here since then, and you know, they're just the same great stories that I have of great doctors, great nurses, and therapists here to help you through all the stages. They had a shirt that they all signed for me that I actually put in a frame that's on my wall, and it's something that sits there that I see all the time. They all have a special place in my heart, and I know they're people that I can come back here to Tidelands and sit down and talk to them, and they'll help me. Just because I'm not a patient right now, if I have a question, but I love the world out of all of them. They're a family, and they're people that I don't think I would ever made it through this situation without their help. And they touch a lot of people's lives.